Trust. It's defined as a firm reliance on the integrity or ability of another person. It's about faith. It's about dependability. But to some people, the people of Interim HealthCare, trust is about much more than that. Trust is about their livelihood, their business, their reputation. Interim HealthCare is built on trust and has been for 40 years. What follows isn't simply a story about a company. It's a story about trust, a story about Interim HealthCare. The modern roots of Interim HealthCare began in the mid-1960s with a company called Labor Pool. At the time, free love was in the air, laughing was on the air, and rock and roll was playing over the air. And while the Beatles were singing about a revolution, a few people were starting one, right here in South Florida. Ray Herridges, Labor Pool's longtime banker, moved from Chicago to Fort Lauderdale, where he set up Medical Personnel Bureau to provide doctors' offices with additional administrative staff. In the following year, Personnel Pool of America bought Medical Personnel Bureau, changed the new division's name to Medical Personnel Pool, and made Ray the first franchisee. As Americans appealed for racial equality in our country, physicians appealed for better care in their patients' homes, and they found it with Medical Personnel Pool. And as the company began shaping an industry, it was also shaping its leadership, naming Al Sorenson president in 1967. By 1969, as the decade came to a close, the folks at NASA weren't the only ones going places. Medical Personnel Pool's franchise concept was taking off, and the company relocated to the much warmer city of Fort Lauderdale, Florida. As the 70s started, everything in life was on the rise, including hemlines, the price of gas, even hairstyles. At Medical Personnel Pool, things were no different, and the company's healthcare business boogied ahead. The company had ascended to the #1 proprietary service in the nation, and it showed no signs of slowing down. As Americans celebrated the birth of the nation 200 years before, Medical Personnel Pool celebrated the birth of supplemental staffing. This breakthrough service was launched at the perfect time. As the economy grew stronger, nurses took other career paths, creating a nationwide shortage. Hospitals turned to Medical Personnel Pool for help, and nurses, still looking to practice their profession, turned to the company as well, looking for better work environments and more flexibility. In the late 70s, as the disco crowd bought every Donna Summer album on the shelf, the executives at H&R Block were focused on buying something else, Personnel Pool of America. Later that year, the Owners Advisory Committee was formed, and with the help of Medical Personnel Pool's leadership, the Home Health and Staffing Services Association was founded in Washington, D.C. With solid backing from H&R Block, Medical Personnel Pool's healthcare division continued to be hot stuff throughout the 70s. As the 80s began, there were few things more popular than Pac-Man and the TV program Dallas, but Medical Personnel Pool happened to be one of them. And while the American hockey team was making a statement in Lake Placid, Medical Personnel Pool was making its own in Washington, D.C., working to change Medicare laws and open new opportunities. As the 80s evolved, so did styles, and Medical Personnel Pool was evolving with them, unveiling a totally rad new logo in 1981. But the logo wasn't all that improved, as the company continued to set new benchmarks, providing 20 million hours of care. By the 1990s, Medical Personnel Pool was a force to be reckoned with, operating like a well-oiled machine. In 1991, as communism was collapsing, the people of the former Soviet Union turned their sights toward a promising future, and Medical Personnel Pool did the same, buying a small publicly held company called Interim Systems. Shortly after, the company launched its new Temporary Heroes ad campaign, an award-winning initiative that told their story in simple and compelling human terms. In '92, the company officially changed its name from Medical Personnel Pool to Interim HealthCare. This new moniker better reflected its scope of services and provided more flexibility to operate diverse business lines. In the mid-90s, the internet was quickly gaining popularity and heads were spinning, and so was Interim HealthCare. In 1996, Braveheart earned the Academy Award for Best Picture, and as Mel Gibson was moving audiences with his cry for freedom, Interim HealthCare was moving stock markets and changing ownership. Towards the end of the 90s, Mark McGwire and Sammy Sosa challenged each other for baseball's home run record, while Interim HealthCare was facing challenges of its own. As the new millennium dawned, Interim HealthCare was at a crossroads. IPS had driven a third of home health agencies out of business. But Interim HealthCare had persevered, and in doing so, had forged a new resolve. The company pushed forward, determined to boost profits and come back better than ever. Interim HealthCare was restructured in almost every area, from finance and marketing to focus and culture. During this time, the company also became one of the industry's first to leverage the internet. In 2001, Interim HealthCare introduced a revolutionary web-based recruitment application that streamlined the hiring process and dramatically reduced the cost of securing employment applications. The company launched its proprietary online resource center, a web-based system providing access to hundreds of marketing and sales tools. Recognizing the need for a state-of-the-art software system for the home care and staffing market, the company developed its own unique system called interLink. But the internet wasn't the only place where Interim HealthCare created opportunity. The company also found it in the country's rapidly aging population. Medicare offered new opportunity, and many of the offices began to focus on meeting the needs of this growing market. The launch of Interim HomeStyle Services extended the Interim brand name and helped promote the company's commitment to keeping America's seniors safe and independent in their own homes. Growth was on the horizon as franchises expanded throughout the United States and Puerto Rico. As Interim HealthCare marks another milestone, a 40-year anniversary, a celebration of the past makes way for a vision of the future. The Interim HealthCare of today is the nation's largest combined provider of home care and medical staffing, and there is no doubt that the company has again arrived at the forefront, right where it belongs. The company's history and future affirm Interim HealthCare's support for the people who count on them, from patients and families to healthcare professionals. It's been this way for 40 years, and it will be this way for 40 more. Why? Because a group of people who honor the commitment made 40 years ago continue to honor that commitment today. A commitment to improve people's lives, a hallmark of the past and the key to an incredibly bright future. Interim HealthCare. We're here.